So good morning. Today's going to be a little bit different, but I'm just going to give a brief update where we stand with COVID-19, 356 days later, 51 weeks. And, today I'm here with Albany County Manager Roy Fluman from Schenectady, and I'm with the County Manager Steve McLaughlin from Rensselaer County in a partnership that we'll be announcing in a few minutes. But I want to thank them both for joining me today. But sadly, I have to start the briefing by saying we had 5 Albany County residents passed away. A woman in her 50s, 2 men in their 80s, a woman in her 80s, and a man in his 90s. My thoughts and prayers go out to the 5 additional family members for these difficult times of losing a loved one. And again, it's hard. It's hard to say goodbye to anyone, but it's harder in these times to say goodbye. So that brings us up to 358 total since the outbreak started almost a year ago. So my condolences goes out to everyone. As of today, there's 20,663 cases of COVID-19 in Albany County, 59 new positive cases today, 46 new positive, yesterday there was 46. On the 5-day average, it's 62.8, and the day before that was 66.4. There are currently 1,478 people currently in mandatory quarantine, and yesterday that number was 1,494. Of the positive cases, 15 have had close contact to a positive case. For healthcare workers, 1 reported traveling out of state, 39 do not have a clear source of infection. As of today, 64,655 people have now completed quarantine. 20,102 of them were positive COVID-19 cases and have recovered. 81 recoveries since yesterday, 4 new hospitalization, 41 people currently in the hospital, and yesterday that number was 41. There are currently 5 people in the ICU. Yesterday that was 4, so that went up 1. Overall, we continue to go in the right direction. Please continue to wear your mask, cough into your arm, clean your hands, stay 6 feet apart. We're getting through this. The light's at the end of the tunnel. Things are improving. So please, by all means, continue to do the right stuff. To get vaccinated at the state-run facilities, check your eligibility. You can continue to check the state's website and their hotline at 1-833-697-4829. United Way, the number 211, thank you to what they're doing. And you can still use the pre-registration tool to get people on the list so we can contact them for future vaccine pods. So again, go to our website, albanycounty.com. You can see your eligibility. You can see if you want to get the COVID-19 testing. And like I said, Whitney Young's not doing it. They're doing it for appointments only at Whitney Young, but they've pretty much changed over the vaccines over to the shots. Again, vaccines are available at the Albany Armory today, at the Washington Armory. Starts today from Rensselaer County, Schenectady, and Albany County in a certain zip code. Registration starts at 8 o'clock for next week for the pods that open up outside that zip code, so that's a good thing. And they're supposed to be doing 1,000 a day for 7 days a week, so that's a good stuff. So we're here to continue to talk about what we're going to be doing on a different approach. But I just want to say this before I get into the other part of this briefing. 6,304 first doses of the vaccine we got out, 2,473 second doses, and these are just the pods at the Times Union Center. As we announced yesterday, we're doing another pod this Saturday. We got more vaccine, and I'm going to get into that in a minute. The partnerships we made with Mohawk Ambulance, Center for Disabled, the different pods that we're getting up. I want to thank, I'm going to have Chairman Andrew Joyce here on Friday to talk about a variety of stuff and the initiatives we've been dealing with the chair's office, one of which I know was one of the legislators announced yesterday, the 100 pod that we're going to be doing at the American Legion Post in West Albany, and the other little pods we're going to set up for people that can't get to the Washington Armory or people can't get to the Times Union Center. And the pods will be announcing on Friday that we'll be doing in the Hilltown. So again, thank you to everyone for that, and and continue to work in the right direction. As of today, we've had over 29,000 people pre-registered. Over 20,000 are Albany County residents, and out of that, over 10,000 are the City of Albany residents. So it's been a huge success, more so than we can handle. So I want to tell you, you got to bear with us. We're trying to work through the kinks. It's changing. When we envisioned this, we thought it was going to be simple, easy to do, but it just shows the need, not just here in Albany County or Schenectady or Rensselaer, across the state of New York. people's frustration of trying to get a vaccine, trying to get a shot, and trying to navigate the website. So, which is a good luxury to have. I can say that. It's a good issue to have, but we're learning a lot as this goes forward and changing with it to make it happen. So please bear with us on that. We have residents that go from one county to the next. We have people that live in Albany that work in Rensselaer County, or live in Rensselaer County, work in Albany or Schenectady. And the one thing is partnerships that really get you through everything. And these last 12 months, one thing I learned from the hub, and the one good thing about the Capital District Hub, that when the governor put that together, was we communicated. We've always communicated in the past. We used to have a quarterly meeting with all of us to discuss how we can work together to go forward on different initiatives, be it on certain topics. But the way we have to work together, the way we have to be in this together, and I can't thank Steve McLaughlin and Rory Fluman for their partnerships to really work for the people. And when you sit there, you usually, when it comes to economic development, we get into competition. I want them in Albany County, he wants them in Rensselaer County, we go back to fighting. And same thing with Schenectady and Albany. Between Schenectady Community College, Hudson Valley, there's a lot of arguments that go on at times on different variety of things. But one thing that has been consistent for these last 12 months is that the three of us have left our egos at the door. We don't get into the political arena. We don't get into anything else. It's about getting vaccine in people's arms. And it's about getting through this health crisis, this economy crisis. And I couldn't have asked for two better partners in Steve Boger up in Saratoga, which we'll be doing stuff with Steve in the Saratoga County, announcing that shortly. But really working with these two gentlemen in these two different counties. And, I've gotten to know Steve closer over the last couple of years. And I got to tell you, he's, heart's into it, doing the right stuff. And we're always trying to figure out how we can make this happen. So it started with a phone conversation I had with Larry Swartz on Saturday, talking about vaccine, get more vaccine. And I know we got the super site, and that's great. And that super site's another useful tool that we have with UAlbany, but we still need to do more. And so we're talking to Larry and going back and forth. And one of the things we decided was like, hey, let's do this in a partnership. Get us more vaccine, and he's like, well, if I get more vaccine, executive, are you going to be able to get out? I said, not only that, I'm going to reach out to our partners in Rensselaer and Schenectady, and we can do this together. Because every shot we get in someone's arm in any county benefits us all here in the capital region, so we can start to get away from this, start to open up, and get back to some type of reality. So Larry set us up for the challenge. We accepted the challenge, and so we're getting more vaccine out. And we'll be allocating 1,000 vaccines to Schenectady County and 1,000 vaccines to Rensselaer County, and more to come, if we get this done, and we're going to get it done, and we're going to get the pods done. So I do want to thank these two gentlemen for the partnership and working this, because this is just in Albany County. This is about Rensselaer and Schenectady working together. And I do want to thank Larry Swartz for everything, but County Executive McLaughlin.
Well said by Dan, and we do appreciate the partnership with Albany County and with Schenectady County and Saratoga County. We do really work well together. I think sometimes people don't necessarily see that, the stuff that's going on behind the scenes, but we do all have a great relationship and the ability to communicate and work together. Early on it was the sharing of PPE and even test kits when they were in such short supply. There was a big help from Dan sending some our way when we really needed it, and that was greatly appreciated. And if you look around this place in the morning, and there's people going back and forth across those bridges and over 890 into Schenectady. This is the capital region. It's not just Albany County and Schenectady and Rensselaer. It's a region, and the intermix between the counties is very real, and it's an everyday basis, as it should be. So Dan's right. Any shot we get in the arm is moving us closer to normal. So we're real appreciative, and we appreciate Larry Schwartz kind of paving the way there on the governor's end of things to allow us to be able to use those vaccines. If you send a whole lot of vaccines anywhere, it's hard to get them all out the door. But when we all work together, it becomes easier. So we're real appreciative of that, Dan, and we'll, as we have every week, every one of us will make sure that those vaccines are 100% used. So I think rapidly, hopefully, we're moving to a place where Anybody that wants a shot can get a shot. I think that day is coming. The president was talking about that yesterday, and I think that day is coming. But for now, there's still a little bit of a supply issue, but it's starting to lighten up. So when we're able to share like this, it just makes everybody's life much, much easier. So thank you, Dan. Appreciate it.
No, Steve, thank you for your leadership. And, it's funny, I get the jokes all the time because I chair of the party and vice chair of the state party. And then they're like, how do you get along with McCoy? I go, we don't talk politics. We just get the job done. And it is. And we go back and forth on badgering things. But, again, it's been a great working relationship. And, it's been great working with you more these last 12 months than ever before. Because one thing I will say about the three of us, it's about the people. But the chair of Schenectady County, Tony Jaginski, who, I talk to a lot too, he's like, talk to Rory. I'm like, who's this Rory Fluman, the county manager? What do you mean county manager? And he goes, he gets it done for us. He was in the legislature. He knows what we need. He knows how to get the job done. And Rory, it's been great working with you these last 12 months and getting to know you because of your passion for Schenectady County, for the residents, but getting it quickly because this stuff gets thrown at us. And I will tell you, to anyone, challenge us three, we'll make sure we get it done. We're going to get it done. And I can't thank the two of you enough, but Rory, please.
Yeah, there's really not too much more to say. This is basics of vaccine equity across the capital region. This week, all the counties received the extra Pfizer allotment, which is terrific. It's a tray. It comes in 1,170 doses. Albany County actually received more trays. And so in our discussions, in our constant communications, as Steve said, we're always talking whether it's about contact tracing or PPE or testing. So there's a constant public health dialogue that's happening all the time. And the hour that it happens that there's potentially more vaccine in Albany County, being able to hand it out to the other counties who are standing and ready. We have nurses, we have data entry people, we have police officers, we have standing sites ready to go to do 1,000 shots a day. So the share from Albany County is tremendous. It'll help Schenectady County, and as Steve says, it'll help the capital region in executing these doses, because that's what we're all here for, is to get these shots in the arms, and we're going to do that. Thank you to Dan McCoy and Albany County.
Rory Fluman, thank you. And I want to thank Dr. Whalen and her team. Sat down, they got what we were trying to do here with the approach of getting this out and the challenge that we accepted. And I do want to thank Larry for making this happen. And hopefully this is going to continue to happen after what we're doing. These pods will be for 65 and above population. So and then we're going to be we'll be having another pod on Saturday. We're expecting to do ourselves here in Albany County 2,200 to keep a little bit more for me. I do apologize, guys. So I wasn't going to put that number out there, but we kept a little bit more for us. But again, we are going to be doing a big pod on Saturday, and I look forward to this partnership, and getting things done. And that's what it's about. It's about working together for the people at the end of the day, leaving the egos and the politics at the door. I can assure you that never falls into play when the three of us are together, or when I'm working in a partnership with any other county administrator or chair. And I do want to thank Steve Aquario from NISAC for being a great leader in helping us always put this together across this thing. And Steve's right, what we did in the beginning, sharing PPE, helping one another out. There's stories that will never be told, but I can assure you this. A lot of people rolled up their sleeves to make it happen because, again, we're all one New Yorkers. We're together in this. And the only way we're going to get through this is by working together in a partnership. And the finger pointing can be done later down the road. It's going to happen. But let's just leave the finger pointing and the naysayers and the negativity at the door. Let's just be positive. Let's get through this. We're New Yorkers. We'll get through it together. And again, we're going to get through it together, working with Steve and working with Rory, and Steve Bolger up in Saratoga, the county manager up there, and just working with everyone. So I do want to thank them. As a reminder, restaurant workers along with taxi, Uber, Lyft, and other drivers are now eligible to get vaccines at Albany County. I will put this out there. We need to get approval, and we need to, and I'm going to advocate and been advocating for our workforce. This is crazy that all these other people are falling into line, but yet I can't get vaccine for my public defenders. I can't get vaccine for my DSS workers, or my water purification district that literally is in, all day long working shoulder to shoulder, or DPW workers that, which I think Rory or Steve was saying, they have wing people with them in their vehicles. They're together. They dig a hole. Steve was saying earlier, they're together. We have to open up for them because look, they've been on the front line. They've been hanging in there for 12 months, coming to work every day, doing the job so government can run. So when we look at this, we got to make sure that we get this done. And please, so hopefully they hear this and continue to open up. I was good about the underlying health issues. I'm glad we finally got that taken care of. Again, food pantry workers were put in there, frontline workers at hotels, and I would imagine there's going to be a variety more stuff opening up and continue to go in that right direction. Please, mental health. If you need mental health support, it's available 7 days a week here at the county, and that number is 518-269-6634. Our 24-hour sexual assault hotline number is always 518-447-7716. The 211, the New York State hotline. Go to our website. Please, by all means, continue. I know we're all getting COVID fatigue. I know we're getting tired out there. The lights here, like I said, I wish I was wrong. And, I said this in the beginning, I think day one, it's going to be a marathon, not a sprint. And unfortunately, probably September, October, before we really feel in type of normalcy again. But we got to brace for that mentally, be prepared for that. Hopefully this other wave doesn't affect us this month near the spring. So please, when it gets warmer out, please socially distance, wear your mask, cough in your arm, clean your hands, stay 6 feet apart. We'll get through this. But what you do in this course of this month coming with this new virus from the UK and the other strains coming in, we have to be careful. We have to be vigilant. Please be safe out there.